So plastic surgery is all the rage. It's all over social media, at cocktail parties, everyone's talking about it. However, there are people who are still scared of having plastic surgery. So today, we are going to talk about the top 5 reasons why people are worried about having plastic surgery and hopefully demystifying these issues for you. Welcome to the center. My name is Dr. Babak Azizzadeh. I'm a facial plastic surgeon that specializes in facelifts, facial reanimation, and rhinoplasty, located in Beverly Hills, California. Here, we talk about all things facial plastic surgery. Welcome to the channel. So if you're interested in learning more about plastic surgery, please like, comment, and subscribe to my channel. So the first reason I think people are afraid of having plastic surgery, or actually elective surgery, is anesthesia. People have heard so many things about anesthesia, and anesthesia definitely is a risk of surgery. But if your plastic surgeon is very conscientious, they have referred you to getting a pre-surgery medical clearance by an internist or a family medicine doctor or a cardiologist, and you're healthy, you're not a smoker, you don't have any major medical or cardiovascular disease, you will likely have an excellent outcome. So anesthesia has become very safe over the past decade or two. The drugs that people use for anesthesia are very safe. The quality of anesthesiologists is very high. And again, it's all related to the attention to detail, the team that your surgeon is surrounded with, the facility that they operate in. The second reason people may be afraid of plastic surgery is the complications associated with plastic surgery. And there are risks. For instance, people can get facial nerve disorders with facelifts if those surgeries aren't performed by a great surgeon or with detail, or even when they are performed by great surgeons, there are risks involved. However, I would say the risks of plastic surgery, specifically facial plastic surgery, can be minimized with the following facts. Your surgeon is really important in this factor because different surgeons have different complication profiles. Now, complications can happen to anybody. And unfortunately, there is no surgeon that's perfect, and there's no surgery that has 0 complications. However, in the hands of the best surgeons and in the hands of surgeons who have the highest level of expertise and experience, you see the complication risks go down significantly. So I would say that definitely this is an area to be concerned about, but really in the hands of the best surgeons, the complication risks with plastic surgery goes down significantly. Okay, the third reason that some people are afraid of plastic surgery is they don't want to look unnatural. They think, for instance, if I get a facelift, I'm going to have a plastic look. Or if they get their eyes done, they're going to have a look of having their eyes done. And definitely that risk exists. However, this is where the artistic aspect of your surgeon comes into play. Number one, you and your surgeon need to have really great conversations about what you're looking for. Number two, you have to look at your surgeons before and afters to see what the typical individuals, what his artistic eye is, what the typical individuals look like. And number three, the surgeon's artistic eye is so critical in the way that they create a harmony and balance, whether it's doing facial plastic surgery, facelifts, eyelid work, or body work. The artistic sense really determines what the naturalness of the results are. And really, in the hands of the best surgeons, the artistic eye, your outcomes should be supernatural, and no one should be able to tell when you walk into a room that you've had plastic surgery. Now, there are times that I am treating bad plastic surgery, someone that looks really unnatural. I will do everything I can, and most of the time very successful in reversing that. But there are times that, it's so significant that even when I do my best work, they still have some level of unnaturalness. The other thing is that we don't want to ever create a look that makes you like a different person. We want to preserve your essence, and that's a sign of great plastic surgery. Your essence needs to remain that way. So that is really the key to an artistic approach to plastic surgery. Not all plastic surgeons are the same. Not all facelifts are the same. Not all breast augs are the same. You need to look at the artistic flavor of what your plastic surgeon does to see and make sure that those visions are aligned. The fourth reason people are afraid of having plastic surgery is downtime. Everyone's busy. Everyone has stuff to do, and being, away from work or family or obligations for several weeks is a problem for some people. That's where I would say you really need to discuss with your surgeon what their experiences is with downtime. Now, for instance, there are lasers that we used to do that the downtime was 2 to 3 months, but now those lasers have a downtime of 10 days. There are facelifts that sometimes the downtime can be 3 or 4 weeks. There are others that it can be 10 to 14 days. And there are certain procedures that are really lunchtime and don't have a lot of downtime. So it all depends on the procedure and on your surgeon and what actually you guys decide on. But it is an important part. You need to give yourself plenty of time to get the healing process done. So for instance, a lot of people want to get their, teenagers and young adults want to get their noses done Christmas break. I always recommend, no, do it in summer when you have several weeks for the nose to settle down. Even though you'll be ready to go in a few days or a week or 10 days to go out socializing, we want to give you plenty of time. But for the most part, most surgeries, I would say we have a 10-day downtime to get back to your, running your day-to-day, 3 to 4 weeks before things look really good, 6 months for soft tissue healing to be completed, and really little fine details of the surgery may take up to a year. So talk to your surgeon, make sure you have the time, those 10 days, 14 days, and have it done correctly. So finally, the biggest fear, I think, is people don't want to get botched. Most people seek plastic surgery. They're happy. They have some aging process, or maybe they have a bump on their nose. Maybe they're self-conscious about an issue, asymmetry. They're like, wait, I'm like, I look fine. I'm happy. Why am I going to risk having a botched outcome? And I will tell you that today, in this era, the likelihood of getting a botched outcome is low if you go to a real professional, someone who is board certified, someone who's been trained in that particular area, someone who has experience. If you look at a surgeon's experience in the particular procedure you're doing, let's say it's eyelid surgery, and you look at their before and afters, and they have more than just 1 or 2 before and afters, and they've had great experience. They're board certified either in plastic surgery, facial plastic surgery, or oculoplastic surgery. The likelihood of you getting a botched major complication, eyelids being majorly problematic, or getting super complications is pretty low. So I would say that comes really to 2 issues. One is your homework, and 2 is making sure you're not getting surgery by someone who's not licensed, trained in that particular area, or certified to do that surgery. So your homework is very critical. If you do your homework correctly, find the right surgeon, find the right experienced surgeon who has great artistic eye, the likelihood of getting botched is extremely low. So people's fears of plastic surgery is valid, absolutely. But today, if you do your homework and if you find great plastic surgeons, dermatologists, facial plastic surgeons, oculoplastic surgeons, hair restoration experts, the chances of a really major complication or really major poor outcome is very low. So I would say, in summary, just make sure you do your homework, get great advice, and make sure that you have been able to kind of vet your doctor appropriately, and I think you'll have a great outcome. Please like, comment, and subscribe to our channel, and I appreciate you tuning in today.